Hello, Dr. G here for naturalfoodsdiet.org. One of the most common ways our doctors get us on the slippery slope of dependence on drugs is to innocently, and maybe sometimes it's not so innocent, but they place us on blood pressure medication. Now, what do I recommend for evaluation as far as blood pressure is concerned? Well, first, it's critically important to be sure your blood pressure is really high. Now, just because it's elevated in the doctor's office doesn't necessarily mean you have high blood pressure. Now, if I thought about it, if some fat guy with rubber gloves looked at me with a smile, I'm sure my blood pressure would skyrocket as well. Now, for a blood pressure reading to be valid, you're supposed to sit quietly for 5 minutes before you take the measurement. And you're not supposed to be stressed out over whether or not someone with a rubber glove is about to penetrate you. Now, patients are never stressed in my office because I always put on my rubber gloves after the blood pressure reading has been taken. Now, when I do have a patient that has a high reading in the office, I recommend that they invest in their health by buying a home blood pressure monitor and keep a diary of blood pressure at various times during the day and waiting the requisite 5 minutes before taking it. So here, for $20 or $30 investment, many times this is the end of the story. Their blood pressure isn't really high at all, and I just saved that person from a lifetime of taking pills with possible side effects, and I've saved society from having to pay for the bloated price of new blood pressure drugs that have limited evidence for any long-term benefit. Now, when I do find an elevated blood pressure, I think of it as a symptom and not a disease in and of itself. And I always look for the root cause. The most common ones are poor nutrition, toxicity, lack of physical exercise, stress, and cellular dysfunction. If I do ultimately have to treat it, I use natural treatments first, like nutrition, weight loss, herbs, vitamins, stress reduction, exercise, and minerals. Now, if I need to go further, I start with the drugs that have a proven track record of safety and significant improvement in outcomes, such as heart attacks, strokes, and mortality. By the way, none of the new expensive blood pressure medications have this evidence behind them. These drugs are marketed solely as a result of pharmaceutical company profiteering. And it's the cost of this profiteering is borne by all of us as individuals and societies in dollars and in reduced quality of life from drug side effects and ineffectiveness. Now, check out my previous videos on the natural treatment of blood pressure and another one I posted on the use of the older tried and true medications. If you like this video and this kind of health information, please subscribe to the channel and the blog and share this with your friends and family. This is Dr. G. Thanks for watching.